And the next session we're having is from Pfizer Wiser, and it's pre-recorded, so we're gonna play it for you guys to hear. But let me tell you a little thing about Pfizer Wazia. She's a graduate student in disaster science and climate resilience at the University of Dhaka. She's known as an open mapping guru. She has contributed to numerous projects across Bangladesh and Asia using OpenStreetMap. To tackle disaster risk and urban challenges. And as a climate resilience fellow, she led a capstone project mapping waterlogging and dengue risk in Dhaka's informal settlements through community engagement. So Pfizer has participated in many national and international mapping events and training, and strongly advocates for inclusive, open data-driven resilience efforts led by youth and marginalized community. And she's going to be talking about resilience starts with a map, community-led OpenStreetMap action in Dakar's climate vulnerable settlements.
Hi everyone, I hope everyone is enjoying the conference. I am Faiza Waziha and I am an OM guru and also a fellow in the Climate Resilience Fellowship. I am really grateful to have this opportunity to share my experience as a CRF fellow with all of you guys. So, what is this fellowship I am talking about? This is an initiative taken by the Humanitarian OpenStreetMap team and Open Mapping Hub Asia Pacific, where they empower young leaders like me to design and implement community led projects as capstone projects to implement address urgent climate issues, especially in climate vulnerable cities like Dhaka and Chittagong. It was founded by Net Hope and World Vision as a partner in this project. There are 20 of us working in pairs, and each and every one of us is trying to tackle the climate risk that our city's most neglected and vulnerable people face every day. These 10 projects are addressing heat waves, waterlogging, wash problems, vector borne disease outbreaks, and waste management issues that affect people who cannot fend for themselves. Before we entered the implementation phase, we went through an 11-week intensive training program where we learned a lot. From the training, we gained knowledge about different open data sources for climate action, GIS and data analysis, and also the concept of JETC. And most importantly, how to design and conceptualize our capstone projects. Here I am pitching our idea during the culmination week where we met with our fellows, mentors, and organizers to refine our ideas. And this is my teammate Risa Tara Mim. Before diving into our capstone project, I would like to portray the real scenario of the slums of Dhaka. Many slums are growing inside Dhaka. Some people are here for better opportunities while others migrated as climate migrants. These settlements grow illegally, which is one of the main reasons they cannot access basic human needs. As risk increase, these people are facing severe climate related hazards that quickly turn into disasters. Some facing severe climate related hazards. Regularly, they face waterlogging, fire incident, poor or non existent waste management systems, inadequate wash facilities, and also heat wave. Mim and I noticed that these disasters also open the door to another severe hazard that lurks behind that curtain or inside a disposed drum. It is the outbreak of vector borne diseases. The situation is worsening every year. In 2024, Bangladesh experienced its worst dengue outbreak in years, with over 500 deaths and more than 100,000 hospitalizations nationwide. Even then, we don't even know the actual number of cases among people living inside the slums. So, with this thought, we launched our initiative called DPACT, Defend, Prevent, and Act Together for Community Resilience, where we are working to build up resilient communities so that they can defend against, prevent from, and act during outbreaks of vector borne diseases like dengue, chikungunya, and malaria. For our project site, we selected a slum situated in a low-lying area that was originally meant to be a water body to catch excess rainwater during the rainy season. But now there are 1200 households that are surviving there. And this was the scenario. Open drains, piles of waste, clogged water, an ideal situation for mosquitoes to breed and diseases to spread. Their living conditions were also very poor. They used open hanging toilets for wash facilities, tin shed houses for living, and bamboo paths to move around. This helped us determine that addressing vector borne diseases should be our focus. One of our project's main objective is to increase the capacity of community members by spreading awareness among them and visually presenting potential risk areas through hazard mapping. Our youth mappers conducted a ground survey to identify features like water accumulation zone, mosquito breeding areas, wash facilities, and healthcare services in the slum to create a hazard map and further integrate these into OSM. From our survey so far, we have mapped 75 points, including 26 sanitation facilities, toilets and baths, and 20 mosquito breeding zones, 14 water facilities, 12 waste disposal points, and others. We also used Mapillary to take street level imagery of the slums roads, giving us opportunities to validate our findings. You can also check them out in Mapillary. And when we conducted our awareness session, the community was very welcoming and eager to learn how they could become more prepared, more resilient against the odds stacked against them. They also shared their struggles, their stories, and their hopes with us. Lastly, I want to finish my presentation with a realization I've had while working on this project. These people are much more resilient than most of us. They are constantly fighting to survive, to put food on the table. They just need some tools, some knowledge, and a little bit of support to amplify the strengths they already have. If we can stand beside them, not as saviors, but as partners, then together we can build communities that are not just surviving disasters but prepared to face them head on and thrive despite that. Thank you very much, everyone. I hope you have any questions, so feel free to ask any questions. Bye bye.